So for abdominal draping, the bony landmarks are going to be the xiphoid process and both ASIS. So before you place the towel over the client's upper chest, make sure that the fold of the sheet that you have is far enough down so that when you pull on the sheet, it won't come down with the towel. So make sure that you have this fold as far enough down. All right, so take your towel, and we need to adjust the towel, because if I lay the entire towel on my client, it's going to already be covering all of the abdomen. So instead, what you want to do is take the towel and kind of fold it so about a third of the towel is hanging down on the other side. You're going to place the towel over the client's torso, and you're going to make sure that the towel is actually higher than the level of the sheet. Next, you want to undrape each arm separately. So remember to pin the sheet to the clavicle and to the GH joint. Fold both the towel and the sheet over your forearm. Grab the client's wrist, bring it out. Bring the towel and the sheet down. Bend the client's elbow and ask them to hold on to the towel. Move to the other side. Same thing, I'm going to pin the towel to the clavicle and to the shoulder. Fold both over my forearm. Bring this down. Bend the elbow and ask the client, again, just to hold on to the towel, not the sheet. After you have uncovered both of the arms, next we're going to locate the ASIS. Remember, when you locate the ASIS, not to use your finger pads, but to use the palm of your hand. Confidently come in and find it. Usually it's very easily palpable. I'm going to take the top sheet and tuck into the client's undergarment right here. So I'm going to just tuck here, and then I'm going to reach across the body and tuck here as well. One thing to remember is you don't want to tuck across like we do on the back. Tuck here and then reach across and tuck there. Ask the client to hold on to the towel firmly, and then you take the edge of the sheet, bring it down, much as we do with back draping, to uncover the abdomen, and then just lay the sheet down on the legs. Now, I'm not exactly all the way secure. I'd need to tuck underneath the back here. So tuck this under. I'll tuck the other side as well, but while I'm here, I'm going to go ahead and undrape for the xiphoid process. Remember, when we find the xiphoid, we're going to use this space between our thumb and middle finger, come under the 10th rib, and then slowly walk that middle finger up until I find the xiphoid process. This is where the towel needs to go to. So I'm going to roll the towel under till about that point. Fold this down, and then bring the client's arm down as well. This is nice and secure, so that won't be going anywhere. Move to the other side. Again, tuck the sheet under the low back. Roll this up so that the xiphoid process is out from underneath the towel. Fold the sheet, or fold the towel, excuse me, and then bring the arm down. So we've got the ASIS uncovered and the xiphoid process. So that is our draping for abdominal massage. Now that the abdomen is undraped, we're ready to start the actual massage portion. Just with any type of massage that we do, we're going to start without lotion, kind of warm the tissue up a little bit, and then add our lotion. We're going to start with the resting position. So make sure that your hands are nice and warm, and I'm going to lay my hands right in the center of the abdomen, right over rectus abdominis. Remember that rectus abdominis starts down at the pubic crest and travels up the abdomen up to the xiphoid process. So it's not the entire abdomen, it's just this portion here. So when I lay my hands on that resting position, my fingers are on one side of rectus abdominis and my palm is on the other side. So I'm going to ask my client to take some nice deep breaths in and instruct them to try and breathe through more their diaphragm, which is going to raise my hands up so that they start to really relax and not breathe through their chest. So after about 3 or 4 deep breaths, I'm going to start with the first technique, which is called the wave. So my fingers are here and my palms are here, and I'm just going to start to slowly pull my fingers towards me and then push my palms away from me. Pull my fingers towards me and push my palms away from me. Notice that I'm not sliding, I'm not gliding across the abdomen. My hands are in one place and I'm pulling and then I'm pushing. So you are creating, in a sense, a wave right on top of rectus abdominis. Working in this area, the client may at times try to hold their breath. Periodically try and make sure that the client is in fact still breathing. So after doing the wave, again, we have not added lotion, we're still just trying to warm the area up. I'm going to start with sun and moon, our second technique. Remember, when we do any circular patterns on the abdomen, they must go in a clockwise fashion. This is how the large intestine runs, so it would be in a clockwise fashion. So, sun and moon. One hand is the sun, the second hand is the moon, and you're just going to slowly rotate them around the abdomen. Notice when my second hand gets to the wrist of my first hand, it basically just leapfrogs, travels over that, and then back down on the tissue. So at this point, I'm starting to get a nice warmth in my hands, and the client at this point should be feeling a nice kind of warming effect in the abdomen too. Because we don't have lotion on yet, this circular sun and moon technique might seem a little awkward to perform. Your hands might kind of stick a little bit, but again, just warm the tissue up first. All right, now I've done the wave and I've done sun and moon, so it's time to add our lotion to the client. Try and keep a hand in contact with them. Take out your lotion and put about a quarter size amount in your palm and really warm the lotion up before we turn our hands over onto the abdomen. So warm the lotion up. And I'm going to use, in this instance, I'm going to use a light wringing all the way across the abdomen just to apply the lotion to begin with. I'm going to just spread the lotion on with a very light wringing technique. Once that lotion is on, then I'm going to come back to my sun and moon technique. And I'm going to start going in just a little bit deeper into the tissue now. You'll probably periodically, want to check in on the pressure and make sure that it is okay with your client. Are we good so far? All right, so I'm back at the sun and moon. And I'm going to get just a little bit deeper again. And my hands are just traveling in that circle. Next, I'm going to start working on the opposite side from where I'm standing. So, I'm going to just slide my hands over, and basically body mechanic wise, I'm just sitting kind of in a squat at the moment. And I'm going to start, my first technique over here is going to be a light wringing technique. So your hands are kind of just sliding past each other between the iliac crest, which is here, and the 10th rib, which is here. So they're just sliding past in a ringing technique. This is a technique very much like we use in the low back during our back protocol. So I'm just sliding back and forth. And I'm going to get just a little bit deeper here as well. We're right on the oblique muscles now of the abdomen. Remember to kind of move your body back and forth with this technique. I've gotten just a little bit deeper. Still good? Okay. Transitioning into squeeze kneading. Obviously, this is a petrissage technique. It's a lot deeper, it's more specific. And here again, I'm kind of shifting my weight back and forth. It helps propel the technique. So squeeze kneading right into those oblique muscles. Try to keep your shoulders relaxed and again your head up. We're trying to still perform with good body mechanics here. No need to look down. And then I'm going to transition from squeeze kneading into the technique we call the scrape. So I'm going to reach underneath the client, and I'm not going to reach all the way under. Just you're going to come under the low back, and I'm going to sit back and scrape my hand along the iliac crest. And when I finished with one hand, I'm going to bring my second hand under and scrape along the iliac crest. The reason that we're doing this, remember, these oblique muscles have attachments all along that iliac crest. And so just alternately, one hand at a time, scraping. And you can even you can do it with two hands as well, if you feel more comfortable and get a little more power with it. Again, scraping along that iliac crest. All right, I've completed one side. So, as a transition, I'm going to come back to my sun and moon, but I'm going to stay with my good steady pressure. Don't lighten up on your pressure as of yet. I'm going to stay with this good steady pressure. Now, I've got to get to the other side of the client, but I want to kind of try and keep some good contact as I go. So, to get to the other side, I'm going to come around the top of the table and have my hands on their shoulders. So I'm going to interrupt my sun and moon briefly as I put one hand on the shoulder, my second hand on the other shoulder, step to the other side, and resume exactly what I was doing with the sun and moon. And I'm going to continue with that firm pressure. I'm not going to have lightened up on my pressure at all. So you can see that I'm at a good pressure going into the abdomen here. Now I need to do the other side of the abdomen. So I'm going to slide my hands across and I'm going to do the same techniques that I did on the first side, starting with ringing. I'm going to start it a little bit lighter. And then I'm going to just kind of increase my pressure a little bit as I go. Again, your hands are sliding past the 10th rib and the iliac crest. Again, remember to keep as the therapist, your lower body moving as you work. And then transition into second technique on the side, which is squeeze kneading. Nice and slow. All of the techniques here on the abdomen should be slow. It's not rushed. It's not fast at all. This is just a very relaxing portion of your treatment for your client. As you can see, I can pick up a lot of tissue and pass it back and forth. Again, I'm right on those external obliques, for example. And then the scrape, I'm going to reach under, and I'm going to use two hands first and then one just to show you two variations, and sit back almost like you were sitting in a chair. You're scraping your hand along the iliac crest. Come in both hands again, sit back. Whichever one of these is easiest for you to perform. Remember, it's you working wisely, efficiently. The other option here would be one hand and then the second hand. But again, very nice, fluid, slow movements as we go. All right, I finished my second side, so I'm going to come back again to my center point with my sun and moon technique, my circular technique, which is going in a clockwise fashion. I have one more technique to do to finish my treatment. And that is, I'm going to push upward or superiorly along the abs, come under the back, and then come up while I rock the client. So you will place finger pads on either side of the abdomen, right above the sheet. Ask the client to take a nice deep breath in. On their exhale, push up along rectus abdominis. Your thumbs will go under that 10th rib. Come under. Again, we don't need to reach too far under, just come a little bit under. Stop, have the client take a deep breath in. And again, on the exhale, I'm going to sit back and pull my hands towards me as I rock the client back and forth. We'll do that about 2 times. So again, I'll stop here, take a deep breath in. On the exhale, push my fingers superiorly along rectus abdominis. Slide my hands apart as my thumbs kind of trace along the 10th rib. Come underneath the back. Stop, breath in. And exhale, lean back. Rock the client and bring your hands towards the center. Then our final technique, we're going to go back to our sun and moon, which is our circular motion. And then I'm going to end with the wave. And as you do this final technique, try to send some very good, warm, healing, positive energy into your client. And then just slowly start to come out. And then just slowly break contact. And then we need to redrape the client. So what you'll do is put their arms underneath the sheet. Take the sheet, pull it up. Do not cover the client's face. So instead, just kind of pull it up like this, sort of bunching it up until the tucks come out by the ASIS. Fold the sheet back over the client. Pin the sheet to the clavicles, and then ask the client to bring the towel out on their own. And they can just set it on the ground or they can hand it to you. And then help them get their arm back under. And that is abdominal draping and massage.